When you look at the number of infected in the U.S. and the number of hospitalizations, can you juxtapose that compared to the encouraging news that we had about a vaccine today? What happened this week? What happens in the next couple of months?
Yeah, well, the cases are not looking great. And so it is, I think, very, very optimistic to see this vaccine. And I think everyone's very hopeful. That being said, the vaccine is not going to be a silver bullet for the pandemic. We need not just production, but also uptake. And so as we're watching these cases tick up and tick up and tick up across the country, I think everyone is hoping that people move into the holidays and move into winter very cautiously. I saw yesterday that the stocks, the air industry stocks went up on the news of the vaccine, which means I think everyone's very hopeful and excited that things are going to get back to normal. But it's definitely going to take a while to get there, even with one or two vaccines coming online.
Lauren, the numbers are absolutely extraordinary. Mayor de Blasio in New York talking about a cusp of a resurgence in New York, which seems to be way behind some of these most challenged states. And yet in Washington, as I mentioned to Kevin Cirilli a half hour ago, it just seems to be completely off the radar. What does someone like you in the trenches want to see out of Washington right now?
I think one of the things we'd really like to see is a joint task force working on this. We've seen that in former administrations during a handover when there's a crisis. I'd like to see activities moving towards ramping up the Defense Production Act, building national strategies for testing, which we still don't have in any systematic way. All of these things can be happening even as the transition to the new administration happens. I'm hopeful seeing some of the names on President-elect Biden's new task force, but I would like to see that task force working with the current administration to really move some of these activities forward, to really make sure that we don't have to wait until January to see a scale up in the response.
Lauren, is the vaccine really the only way to control this virus? And how hopeful are you that we'll get something in the next 6 months that we'll be able to distribute correctly?
I would say the vaccine, or a vaccine, is the most important tool in our toolkit. And I think we're moving really closer to having that readily available, not just with this vaccine, but with several of the other ones that are in phase 3. So the promising data is really exciting. That being said, we saw a press release. We don't know if this vaccine prevents infection or prevents severe disease. We have to wait to see what the data looks like to see how strong this vaccine is going to have, how strong the impact is going to be. Things like masking, things like social distancing, contact tracing, all of these public health tools that we have had and have applied in very disparate measures remain incredibly important, and probably more important until that vaccine is widely available. The other challenge with this vaccine is that the cold chain storage, so how you move it around, it has to be kept at minus 70 Celsius. And that is a real challenge globally for how you distribute a vaccine like this. I think the activities around making sure that we can do that effectively are ramping up, but the logistics on that side of vaccine distribution are going to be incredible.